Hello everybody, I am Dr. Payal Bajaj, Senior IVF Specialist, Aveya Fertility, Rajouri Garden, Delhi. I welcome you all to our next session of Facebook Live. लुइस ब्राउन, नाम तो सुना होगा। जी हाँ, लुइस ब्राउन दुनिया की पहली टेस्ट ट्यूब बेबी है। लुइस ब्राउन is the name of the world's first test tube baby. But today I'm going to tell you about her mother, Leslie Brown. So Leslie Brown and her husband, they had been trying to conceive for good 9 years. And after struggling from 9 years of infertility, they finally landed up, and they took all sorts of treatments, and they finally landed up in IVF, that is in vitro fertilization, and then had a beautiful baby, Louis Brown, and the rest is history. But what was the cause of her infertility? Why was she struggling for 9 years? So the reason for her infertility was blockage of her both fallopian tubes. जी हाँ, यही हमारा आज का टॉपिक भी है. What is fallopian tube? Why do they get blocked? How can we test for the blockage of fallopian tubes? And what to do next when we have found out now that your tubes are blocked? IVF was initially designed to help such patients only who had their tubes blocked. But with advancement in technology, now IVF is used for many other reasons also. But initially it was designed to help such patients only. Now let me tell you what are fallopian tubes, why do they get blocked, and how can you test for it, and how will we help you when your fallopian tubes have been found to be blocked. Let me show you this. Fallopian tubes are two hollow structures on either side of the uterus. They are almost 12 to 15 centimeters in length with 1 millimeter diameter. On one end, the tubes, they are connected with the uterus, and on the other end, they are connected with the ovaries. So what is the function, what is the role of the fallopian tubes? Your egg and your sperm, they meet inside the tubes. Your embryo is formed inside the tube. So your egg and sperm, they fertilize inside the tube. Hence, your tubes, they provide a site of fertilization. Then, this embryo remains inside the tube for almost 3-4 days. That is, आपका egg और sperm आपकी ट्यूब में मिलते हैं, फर्टिलाइज होते हैं, भ्रूण बनता है. शुरुआत के 3-4 दिन तक वो भ्रूण आपकी ट्यूब में ही रहता है. उसके बाद उस भ्रूण को ट्यूब पुश करती हैं यूट्रस के अंदर, बच्चेदानी के अंदर. So your embryo is then pushed by the cilia on the cells of the tube back into the uterus, and when your embryo gets implanted in the uterus, the patient gets pregnant. So now, what are the causes? Why do these tubes, they get blocked? So one of the main reasons always remains infection. Now this infection can be chronic pelvic infection, it can be sexually transmitted infections like chlamydia, gonorrhea. In India, tuberculosis is endemic, and hence tuberculosis also remains one of the very common causes of blockage of the tubes. Now what happens with infection? Infection causes some swelling or inflammation inside the tube, which causes blockage of the tube, and it can also cause some scarring or adhesions inside the tube, leading to the blockage of the tube. Now this tube can be damaged or blocked due to some other reasons also. For example, a patient has undergone some surgery in the past. Any surgery for ovarian cyst, endometrioma, fibroid, even cesarean section. So these tubes, they can be accidentally damaged during that surgery also. Now there are certain conditions which can cause peritubal adhesions also. For example, endometriosis. So what is peritubal adhesions? Adhesions outside the tube. Tube के बाहर adhesions. So what happens with peritubal adhesions is that your tube might be open or patent from the inside, but because of the adhesions outside the tube, now the anatomy, normal anatomy of the tube is distorted. That is, the tube-ovarian relationship is disturbed. Now your ovary might be somewhere else and your tube might be somewhere else. And now your tube is not able to capture your ruptured egg. Then rarely there are some conditions in which your tubes can be congenitally absent also. They can be absent by birth. So what are the signs and symptoms of tubal factor, of tubal blockage? Unfortunately, this tubal factor, it cannot be diagnosed in early stages. By the time we come to know about this blockage, the tubal factor, it is already too late and the damage is done. Unless and until patient complains of some low abdominal pain, high grade fever or low grade fever, or excessive vaginal discharge, irregular periods. So unless and until patient is showing some symptoms, we are not able to diagnose the tubal factor in early stages. So we are diagnosing it only in the later stages. So what are the problems? Two major problems that can happen with blockage or with the damage of tubes are infertility and ectopic pregnancy. So now how do we test for the blockage of the tubes? Unfortunately, we cannot check for the blockage of the tubes on ultrasound. Tubes are not visible on ultrasound unless and until they are filled with any fluid or pus. That is the conditions known as hydrosalpinx or pyosalpinx. Unless and until any such condition is present, we cannot see the tubes on ultrasound. So we have to rely on other tests like HSG, SSG, and gold standard is laparoscopy. So what is HSG? HSG is hysterosalpingogram. HSG is the first choice of test which we recommend to the patients to check for the tubal blockage. The advantages of HSG is that it's a relatively non-invasive procedure, relatively cheaper procedure. What we do in HSG is that we are pushing a dye through the cervix and then we check for the movement of the dye through the tubes by X-ray, radiographically. So there are certain disadvantages or drawbacks with HSG, like this is a painful procedure. Patient is getting exposed to radiation. Patient can get allergic reaction to the dye, and there can be flare up of infection. And the accuracy of this procedure remains 60 to 70%. Sometimes there are false positive results with HSG also. Like suppose your HSG test is showing bilateral blockage at the level of the cornua, the proximal blockage. But this blockage can be due to muscular spasm at the level of the cornua also, especially when you are doing this test without anesthesia and the patient is experiencing a lot of pain. So that can lead to a temporary muscular spasm at the level of the cornua, which will give the impression that your tubes are blocked. But actually they are not blocked. So the next test is SSG. In SSG now we are pushing saline instead of the dye, and we are checking the movement of the saline by ultrasound. SSG is a relatively better tolerated test and it has a sensitivity of up to 70 to 80%. But the gold standard for checking the patency of tubes is laparoscopy. What we do in laparoscopy is that we make a hole in your abdomen, we put a scope and a camera through that hole, and now we are assessing your tubes under direct vision. So the advantage of laparoscopy is that we can not only check the patency of the tubes, whether they are blocked or not, we can also look at the morphology of the tube, whether they are healthy looking, unhealthy looking, beaded appearance, any hydrosalpinx, etc. And along with tubes, we can look into your other reproductive organs also, like uterus and ovaries, they can also be assessed. So disadvantage of laparoscopy always remains that it is an invasive procedure, operative procedure, patient requires admission, and the cost is also involved. Now, what to do next when we have found that your tubes are blocked? Is tubal factor treatable? This is the actual question. So The answer is yes. To some extent, it is treatable. Actually, it depends upon the site of the blockage, whether your blockage is proximal, distal, or there are multiple blocks in the tube, and the extent of damage of the tube, the extent of scarring of the tube. So, depending upon the pathology, we advise the patient whether to go for tubal surgery or not. But the procedures that we are doing in tubal surgeries are that we can excise that scarred tissue, and we can create a new opening or a new stoma in case of femoral block. So in case of hydrosalpinx, we can operate on hydrosalpinx. So it all depends upon what damage we have found in the tubes. So now there is one special condition which I think I should need to mention. That is, if a patient has undergone tubal ligation and now she is again keen on conceiving. So what can we do for such patients? Patient might have undergone some untoward circumstances in her life, for example, second marriage or a loss of baby. So now she's again keen on conceiving. So what can we do to help such patients? So yes, we can offer them tubal recanalization. But one thing here, one point which you need to remember is that tubal recanalization, this surgery requires skill and expertise, and you cannot do it just anywhere. And this surgery is not without its own complications. Patient can develop extra scarring on the tubes now. Now patient can have even more adhesions, peritubal adhesions, and the success rate of the procedure is on the lower side, that is 15 to 20%. And if these patients now they are trying to conceive naturally, then the chances of ectopic pregnancy are a little on the higher side. So the other option that we can give to the patients is IVF, in vitro fertilization. So the process of fertilization of egg and sperm, which happens in the fallopian tubes, in IVF, that process will now actually happen outside the tubes in the lab in test tube. The advantages of IVF are that it is a relatively less invasive procedure if you compare it with the tubal surgeries. The success rate is higher. Basically, the time taken to conceive, time taken to get pregnant by the patient, it is less if you compare it with the tubal surgeries. And there is also one thing that even after going for tubal surgery and after trying for 6 months to 1 year, the patient can again land up into IVF. So this decision actually is based upon so many other factors also. You need to sit and discuss in detail with your fertility expert whether you should, a patient with tubal blockage, whether should go for tubal surgeries, tubal recanalization, or should go for IVF. So you need to look at the age of the patient, the years of infertility, and is there any other associated factor like any sperm factor, male factor, low AMH. So there are many other factors which also help you in deciding whether now you should go for any tubal surgeries and you need to try naturally, wait for more for 6 months to 1 year, or you should directly take to IVF. Here, on a lighter note, I would like to mention something. मंजिल तक पहुंचा देंगे गालिब, रास्ते और भी हैं. So with this, I would like to end my this live session, and I think now it's time to take few questions, which are very commonly asked questions. So I can see one question: can tubal factor be treated naturally with medicine? I will say to some extent it can be treated naturally with medicines, especially if it's in its early stage, early phase. So if there is only mild swelling or mild inflammation inside the tubes or minor blockage inside the tubes, so that can be treated by tubal flushing. So there are many people, many doctors who are doing tubal flushing with medicines, antibiotics, and there are also many herbal Ayurvedic medicines available for this. So how they help is they basically suppress the inflammation, the swelling, and they might help in opening the tube. Tubal flushing, it might dislodge if there is any minor blockage inside the tube, hence making your tubes patent. But all these things, they are not scientifically proved. There is no data to support all these things. Okay, so one more very commonly asked question is, if only one tube is blocked, then what are the chances to conceive naturally or with IUI? So I will say the chances are very good. You can even conceive with one tube if you're trying naturally or with IUI, especially if the egg in that cycle is forming in that particular ovary on the site on which the tube is patent. So if your egg is forming in that particular ovary, then yes, you stand a very good chance to conceive in that cycle with a single tube. But here, don't forget one thing, that what is the reason for your damage or blockage of the other tube? Is it some infection? Is it tuberculosis? So what is the reason? So I will say that if your one tube is blocked due to some infection, or tuberculosis, something like that, then your other tube, which is patent, which is open, it might not be functional. It might be damaged from inside. So next question is, how is ectopic pregnancy related to damaged tubes? Okay, so when your egg and sperm, they meet inside the tube, they form an embryo. This embryo is a little larger in size as compared to egg and sperm. It's approximately 140 micron. So your egg and sperm, so in case if there is some partial blockage inside your tube, so your egg and sperm, they can cross through that partial blockage, but your embryo will get stuck. Your embryo will not be able to cross through that partial blockage. It will get stuck. Now your embryo will start growing, start developing inside the tube only. The tubes, they are not distensible, unlike uterus. So ultimately, they will not be able to sustain the growing embryo, and your tubes can rupture and you can land up into medical emergency. So this is how ectopic pregnancy is related with damaged tubes. One more important question that we are commonly asked is, if there is hydrosalpinx, then does it need to be removed before IVF? Yes. In case you have a hydrosalpinx, you need to remove it before your embryo transfer. The reason is that this hydrosalpinx, it contains some toxic fluid, and this toxic fluid, when it will reach the cavity, it can damage your embryos. Secondly, it can even cause flushing of your embryos. So yes, you need to remove this hydrosalpinx. The gold standard is salpingectomy. You need to remove this hydrosalpinx. But in case you are not able to remove this hydrosalpinx, at least do clipping. What we do by clipping is, let's say in this tube there is hydrosalpinx, then with clipping you disconnect this tube from the uterus. Now there is no connection between that damaged tube and the uterus. This way your toxic fluid will not reach your cavity and your embryos are safe after embryo transfer. There is one other option as well, which we have been doing as a routine in Aveya, that suppose if a patient has hydrosalpinx and due to whatever reasons we are not able to operate upon that patient, then you can even aspirate that hydrosalpinx before transferring the embryos. And that has also given us good results over here. So in case you have any other queries, you can connect with me via Facebook, Twitter, Insta, Google, Pinterest, LinkedIn. You can even mail us. You can call on Aveya's helpline number, and you can even visit us at Rajouri Garden for first free consultation. Thank you so much.